Hello friends, as promised, I am back to talk about healthcare insurance. Healthcare in the United States is expensive. That's not a surprise to anybody. Everybody knows it is so expensive that most people can't afford to pay out of pocket for it. And even when you do have insurance, and if you have a medical emergency, you're still going to have a ton of medical bills. We're paying a lot for insurance that isn't even all that great. I'm Jennifer, and I have been a registered nurse for 30 years, and I also just retired from 10 years in the healthcare insurance industry. And today I want to talk a little bit about why healthcare and healthcare insurance is so expensive. How can you protect your wallet while still taking care of your health? I mentioned in another video, the last one, that people often feel like they're being held hostage in jobs that they don't really like because of they need health insurance. People who are ready to retire but aren't yet old enough to be eligible for Medicare feel that they are stuck in their careers until, even if they have enough money to retire, they don't feel that they have enough money to pay for healthcare insurance. And so they stay in their jobs that they hate or jobs that they're just ready to leave behind. I remember when I had my first child, it was 1989, and I had just gotten married. I was 19, almost 20 years old, and I lost my job early in my pregnancy, and my husband didn't have any insurance at his job, but this was before the Affordable Care Act, so a lot of people didn't have insurance. But it wasn't a big deal, and we didn't have much money. I didn't work for several months, and my husband was a car mechanic, and we were able to pay. At the time, we moved to a new town. I found an obstetrician, and they said we had to pay for the delivery before I went into the hospital, and it was something like $1,000, $1,500, something like that. And we made payments on it during my pregnancy. And before I even went to the hospital, we had paid the delivery fee. And then my son was born, and we got bills for the hospital stay, and we paid them. And that it did not bankrupt us. This was only 35 years ago. And I remember for several years, I would take my son to the pediatrician, and I would pay for the visit out of pocket. I would go to the dentist to get dental work done. I had a tooth, I had a bad tooth, and I needed a root canal. I paid out of pocket for a root canal. I wasn't making very much money. Healthcare back in the 80s and 90s, the early 90s, was still accessible for most Americans who had a job. And now it's not accessible for people who do have jobs a lot of the time, and for people who have high deductible insurance policies. There's so much that needs to be paid out of pocket. People still don't feel that they can get the care that they need. Let's talk about some of the reasons that healthcare is so expensive in the United States. Administrative costs. About 25% of healthcare spending goes towards administrative costs. That includes billing and processing claims between the hospitals and the insurance companies. It's like billing and coding and claims processing is a whole business. And a lot of that insurance spending goes towards running that business. And of course, we've got good old capitalism. Our insurance is profit-driven. Insurance companies don't just help you pay for care, they're making a huge profit. The CEOs of the largest insurance companies are making millions, tens of millions of dollars a year in salaries and bonuses. They negotiate prices with providers, but the primary goal is to make money for the shareholders. And the primary goal was not to save you money. The primary goal was to make money for the shareholders. And There aren't very many regulations and laws in place to keep health insurance companies from profiting big time off of the American public. So that's where the majority of your healthcare spending is going towards profit-driven healthcare. The insurance companies are getting theirs. The pharmaceutical companies are getting theirs. Now hospitals are owned by corporations a lot of the time, and they are profit-driven as well. So even the facilities are profit-driven. There's a profit. Healthcare is big business, so everybody's got to get their piece of the pie, and that's why your prices and your costs still keep going up. And part of the way that hospitals make their profit is by marking up things. Have you ever seen a hospital bill or heard of somebody who had a hospital bill where they would charge $30 for an aspirin, for example? Hospitals mark up their services and their items so that they can offset the costs that they incur by uninsured patients and lawsuits and other expenses in addition to profit. Another reason is that a lot of times people are overtreated. I could go down a rabbit hole with this one, but doctors and facilities overtreat patients in order to make more money. Sometimes they do that because they are just being extra cautious and they overtreat, but a lot of the time they have financial incentives to overtreat. So there's another reason that your healthcare costs are high. A lot of the treatments that the American people are getting are not even necessary. And forget it if you think your doctor's going to talk to you about lifestyle and diet and the kind of things that you can do on your own to manage your health conditions. There's no money in that, so they're not going to do that. So now that we've talked about the problem, let's talk about maybe some potential solutions. The first thing you can do is understand your insurance plan. Take the time to review your policies, deductibles and copays, and your out-of-pocket maximums. Knowing what's covered and what isn't might help you avoid some surprise bills. And when you do have a bill that you don't understand, ask questions, because it's very common for there to be coding errors and for you to be charged or billed for things that you should not have been billed for. For example, myself, my father died of colon cancer when he was 55 years old. So when I was 50 years old, I asked my doctor about when should I have my first colonoscopy, and reminded her that my father had died of colon cancer when he was 55. And she said, oh, we need to go ahead and start that now. You're already of age. Really should have been doing it since you were 45. So I scheduled my first colonoscopy, and I went and had it. And of course it was normal. I don't have any problems. And I got a bill. I got a bill for the full amount, even though it's a preventative screening. And under the ACA rules, preventative screenings at appropriate ages are covered 100%. I got billed because they coded it as a diagnostic colonoscopy and not a screening colonoscopy. So they coded it as I had a problem that I was going to get checked out, and not that I was just having my regular colonoscopy. And I had to call, and I called the billing department, and we changed it, and then they canceled the bill. So a lot of times you're billed for things that you shouldn't pay for, and you should speak up and ask questions when you think that might be happening. Ask questions before you agree to procedures, surgeries, treatments, medications. A lot of the time, if you need a medication, your doctor will prescribe the newest and most expensive one on the market, because they're getting financial kickbacks to prescribe those, when there are really lots of older meds that have generics that might be just a few dollars out of pocket, instead of the new antibiotic that's $50 for a 1-week course. Can you just take penicillin for $5? That kind of thing. Ask questions. Ask your doctor, is there a less expensive alternative? Don't be ashamed to ask that. They aren't thinking about your pocket when they're prescribing things. They're not thinking about it. So you need to ask for the least expensive option. And you might be surprised how often you can just skip the treatment or the test or whatever if you just ask. And definitely shop around for your medications. Even if you have a prescription health insurance plan, sometimes you might be able to use the GoodRx card, which is free. Look up goodrx.com. There's a prescription discount card you can get. And always check that website before you fill a prescription, because the GoodRx price is sometimes lower even than the prescription insurance price. And you can compare prices at all the local pharmacies in your area on the GoodRx website. Make sure that you're seeing in-network providers before you make an appointment, or when you make an appointment. Make sure that that provider is in your network, because a lot of the time the provider's office is not going to check, and then you're going to go to your visit and then you're going to get a bill and it's not going to be covered by your insurance because nobody bothered to check to see if they were in network. Make sure you're doing that. And preventative care is your best friend. Prioritize your annual checkups, your screenings, all the lifestyle things that keep you healthy, like gym memberships and a good diet, or a dietitian if you have access to that. All of those things will keep you ahead of the health problems, and that is a lot more affordable than getting sick. Here's some budget-friendly health tips for midlife women, because most of my audience are midlife women, ages 45 to 65, 40 to 65. So it sounds cliche, but you really need to prioritize your diet and activity. You don't have to be working out at the gym 5 hours a week, and you don't have to eat the most expensive food in the grocery store, but just eating real food, less processed food, eat real food, mostly plants. That's from Michael Pollan's book, Food Rules. I'll link that in the description. Just very simple rules for how to eat. And make sure you get some activity. Park farther from the store. Take a walk after dinner. Walk the dog. If your dog is overweight, then you probably are too. If your dog is overweight, then you need exercise. And there's my little overweight dog right behind me over there. So I'm with you, but that's just I've heard that before. The regular movement and the decent diet are the best ways to prevent chronic disease like heart disease and diabetes. If you have access to an HSA, healthcare savings account, or a flexible spending account, FSA, through your work insurance plans, a lot of times you'll have choices of which insurance to choose. And if you have an HSA or an FSA option, take advantage of it, because you get to use pre-tax dollars towards your health care. And if you choose an HSA, you can roll that money over that you don't use every year. And even when you retire, if you have HSA money left, then you can use it towards your Medicare or your healthcare costs. So both of those are tax advantaged ways to help pay for your health care. Like I said this before, advocate for yourself. If it's a bill that doesn't look right, challenge it. If your doctor wants to do some treatments that you're not feeling comfortable with and he hasn't fully answered your questions, then get a second opinion. Don't be afraid to advocate for yourself. Don't be afraid to ask questions and push back, because these doctors are not God. Sometimes they want you to think they are, but they are not. And some of them barely made it through medical school, and they are just trying to make a living like everybody else. And they're not looking out for your best interests a lot of the time. I'm not saying they're bad, but they have a lot of work to do, and patients are just numbers. Ask questions. He's working for you. He is not the boss. You are. So ask questions and advocate for yourself. Healthcare costs can be overwhelming, and navigating healthcare and benefits, if you have any, it's all really overwhelming. Just take back your power and advocate for yourself, ask questions, and take care of yourself, The best thing you can do to save money is take care of yourself. If you just understand why prices are so high and understand how to prevent some of those health conditions, you can take some of the power back. If this video was helpful at all, I may not have told you anything you didn't already know. There is no magic bullet. There is no magical reason for healthcare costs being extremely high. But if this has been helpful, please give me a thumbs up down below, and I appreciate you watching. If you'd like to hear more about healthcare and healthcare insurance from my experience in healthcare and healthcare insurance fields, please leave me a comment, let me know, and I'm happy to make more videos on this subject because I got a lot to say about it. Thanks for watching and have a wonderful holiday week.